8 years. Then canine, lower canine is coming at the age of 9 years, and upper canine is coming at the age of 11 years. Okay, so the chronology of central incisor, lateral incisor, and canine, the anterior teeth, you see, the first sequence is coming, the lower central, then upper central and lower lateral is at the same time. Then lately is coming is upper lateral. And in case of canine, lower canine is coming first, then upper canine at the age of 9 years and at the age of 11 years. So for premolars, you see here, the lower premolar and upper premolar usually both starts at the age of 1.5 to 1.75 years of age. And first premolar, second premolar is starting at the age of 2 and 2 to 2.5 years, starts the beginning of calcification. Then crown takes about 3 to 4 years to be completed. Eruption is lower 4 and upper 4 is coming almost at the same time, 10 years. And lower 5 and upper 5 is coming also at the same time, is 11 to 12 years. Okay, so at the age of 10 years, the first deciduous molar is being replaced by the first premolar. And at the age of 11 to 12 years, the second premolar is being replaced, is replacing the second deciduous molar. So this is the sequence for premolars, and it takes about 3 years for completion of the root, definitely. Okay, take care. Attendance. Then chronology of the molars. Molars are non-succedaneous too. They are coming directly into the empty space. Okay, so beginning of calcification of first molar, first permanent molar is at birth. Remember, this is the only tooth which starts its calcification at birth. Bagi kullu asnan of all other permanent tooth starts their calcification after the birth, okay. So this is the only tooth at birth. So second molar starts at the age of 3 years, and third molar starts its calcification at the age of 8 years. So crown takes about 3 to 4 years to be completed. Then eruption, you know the sequence of 6. The first molar is coming at the age of 6 years, second molar is coming at the age of 12 years, and third molar is coming at the age of 18 years. So at the age of 12 years, when the deciduous second molar is being replaced by the second premolar, upper and lower, at the same time the second permanent molar is coming into the oral cavity. Okay, and the root completion takes about another 3 years. Remember, the points here to remember is, at birth, the first permanent molar is the only permanent tooth showing evidence of calcification. Okay, no other tooth. Only first permanent molar has its evidence of calcification. If you take an X-ray immediately after the birth of the baby, you will find it. Dates of eruption of permanent incisors is the same as the deciduous incisors, but in years. You see, 6, 7, 7, 8. The same deciduous tooth is coming at the age of 6 months, 7 months, 8 months, and permanent tooth is coming at the age of 6 years, 7 years, 8 years, like this. Premolars start calcification between 1.5 to 2 and 2 and quarter. Okay. The lower tooth sequence of eruption is 1, 2, 3, 4, 5. Lower tooth is coming in this sequence. The lower tooth sequence of eruption is coming 1, 2, 3, 4, and 5. And upper tooth sequence of eruption is 1, 2, 4, 3, 5. So upper tooth, in case of upper tooth, the sequence is normal, 1, 2, 3, 4, 5. But for lower tooth, but upper tooth, the sequence, the canine is coming lately in the upper jaw. So in upper tooth, the first premolar is coming before the canine. And that is why if I ask you generally which tooth may be impacted in the whole dentition more reasonably, the upper canine. You will see many of the patients is having upper canine, either buccal replaced or lingua replaced or missing. Why? Because he is the last member to come into the dentition, to come into the oral cavity. And if there is not sufficient exercise of the jaw expansion is not sufficient, then he will suffer from lack of space. And due to lack of space, either he tries to come into the buccal position or into the lingual position, or even if he cannot find any place, maybe he is impacted, missing. Okay, remains, lies under the bone. So this is the reason, because he is the last member to come. For example, our classroom is sufficient for U20 student. Who is coming last? No problem. He's coming and getting a seat. But if we have 19 seat only, for example, in anyway, if the last two student who is coming, he will not get a seat. He will stand on the door, right? Like this. This succeeding series is canine is coming and is finding its place buccally or lingually. You can see the premolar, second premolar is coming after canine. Actually, second premolar and canine is coming at the same time in this case. Lower teeth erupts before upper opposing tooth. This is also true for the permanent dentition and as well as deciduous dentition. First, second, and third molars erupt at the age of 6, 12, and 18 years, respectively. This is a sequence of 6. Now you see here, this is the situation, I mean, graphical representation of the situation of tooth in different age point. Okay, so this is at birth. You see the occlusion line. The occlusion line is there. So no tooth is erupting at the same time. What I am seeing in the upper sequence, so similarly we will see in the lower sequence. Okay, lower dentition. So you see the deciduous tooth, central, lateral, canine. First deciduous molar and second deciduous molar, everything is present. But one last tooth is present here also, calcification. This is the first permanent molar. Calcification for first permanent molar is seen at the age of birth. No tooth erupted, odontology. So situation is that every tooth, deciduous tooth, starts its calcification but not yet erupted. It is odontology. Should be normally there is no tooth on the jaw. Developing tooth germ is present for all deciduous tooth, and evidence of calcification present for permanent first molar. Okay, this is the explanation of the jaw line at the age of birth. At the age of 6 months, what is happening? You see here, deciduous incisors are ready to erupt. Deciduous incisors, a crown is already complete. Developing tooth germ is present for permanent central incisor. Evidence of calcification present for permanent canine. You see here the permanent canine, evidence of calcification permanent canine, permanent molar. Calcification present for permanent first molar. Okay, this is calcification starts for the permanent central incisor. Okay, permanent central incisor starts to develop, and lower central deciduous lower central, either it's already in the mouth or it appears to be into the mouth. Okay, it is very soon at the age of 6 months, very soon that they will come into the mouth. Either they came or they will come very soon. At the age of 6 months, what is happening completely, 6 months plus, there is teething. Teething means the starting of the tooth eruption in the deciduous mouth. You see here, the small two teeth into the oral cavity is coming from the mandibular jaw. Teething is the process by which an infant's first tooth, the deciduous or milk tooth, sequentially appear by emerging through the gums. By piercing the gums, it comes into the oral cavity. It has an importance. Why? Common symptoms include drooling or dribbling, mood changes, irritability or crankiness, and swollen gums. crying, sleeplessness, restless sleep at night, and slightly elevated temperature are also associated with teething. When the tooth is coming into the oral cavity, you will get the histological aspect in the third year, inshallah. Actually, what happens when it pierces the bone gradually, day by day, it's okay. But when it pierces the oral mucous membrane, there is little inflammation on the mucous membrane. As a result of inflammation, when there is inflammation in the body, there is some symptoms. One is that area is swollen. Other one is that area may have bleeding. And redness. Number three, the area will have some pain. So when the tooth is coming, actually the baby feels some pain and some inflammation in that area. That makes him very irritable. He or she is crying, does not sleep nicely, and even doesn't want to take food, becomes hungry, and still make it crying. So this happens, usually it happens for the first one or two tooth. Then he is habituated with the situation, or the symptoms may be reduced. Then he is no more doing any problem. Okay. And drooling is that, drooling or dribbling means the saliva is, too much saliva is coming into the mouth, and saliva is getting out from his mouth automatically. Some noticeable symptoms include chewing on their fingers or toys to help relieve pressure on their gums. This is also happening, that they are try to chew your, if you are, he is on your lap, he is holding your finger, and if you put your finger near his mouth, he is chewing the finger, or his toys, he tries to, because there is little bit pain and pressure on the gum where the tooth will come. So he wants to, uh, relieve the pain. So this is drooling, that he has saliva, excess saliva in the mouth, and automatically it is dropping down from his mouth without his consent. This is called drooling. During the teething, it is happening actually, but usually drooling is is a normal procedure for all the babies, infants. At the age of 5 to 9 months, what is happening? Incisors are on the way to erupt with a sequence of lower central, upper lateral, lower lateral. This is the sequence of eruption from the age of 5 months. 5 months, why I tell you 5 months? Because there are sometimes there is early eruption. So 5 months or 6 months to 9 months. Within the 9 months, all the incisors are already in the mouth. At the age of 9 months, you will find the incisors are erupted, all the incisors. That's lower central, lower lateral, upper lateral, all the incisors are already in the mouth. Developing tooth jump for lower central, lateral, and upper lateral is seen. You see, lower central, lower lateral, upper lateral is already present for permanent tooth jump. Upper and lower permanent canine is also present. You see here, upper and lower permanent canine. The permanent first molar tooth jumps are in further growth. So you see these things are here. 9 months, the lower canine is there. 1 year, at the age of 1 year, emergence of lower first deciduous molar. Okay, emergence of lower first deciduous molar. Remember that lower deciduous molar is coming before canine, and upper deciduous canine is upper deciduous molar is also coming before canine. Upper first deciduous molar is also ready to come up soon. 12 months to 14 months. So 12 months the lower come, 14 months maybe the upper will come. 2 years, all deciduous tooth have erupted in position. By the age of 24 months, sometimes if it is late, it takes me about more 6 months. On 24 to 30 months, all the tooth are coming into the oral cavity, deciduous tooth. First permanent molar tooth crown is in advanced stage, and evidence of first premolar tooth develops is seen. At the age of 2 years, you'll find that the most of the crown of the permanent first molar is complete. Though it is within the bone and gum, but most of the crown has been completed. You can understand the shape and size of the crown. And at the same time, the first calcification for the first premolar has been started at the age of 2 years. Okay. 3 years, the formation of crown for permanent canine is seen. You see here, the permanent canine, the crown is already has taken a shape. Also, there is formation of first and second premolars. You see, the first and second premolar is in position under the root of the deciduous tooth. It can be seen. So you will see that deciduous tooth, all the deciduous tooth are into the mouth oral cavity, but many of the permanent tooth gem is ready. Still, no permanent tooth has come into the oral cavity, but the patient is having, the boy or she is having all his or her deciduous tooth into the oral cavity. At the age of 3 years, what is happening? Formation of crown for permanent first molar is almost complete. Evidence, that's okay. Okay, 3 years. You see here, 3 years, 3 to 5 years. Another thing is happening. You will find because that the previous slide we told what is happening under the bone and gum. But above the bone and gum, the tooth. You see what happens? The tooth is having spacing. Why spacing? Because the deciduous tooth was small. Okay, all the deciduous tooth were small. But the jaw is gradually developing now, becoming bigger because the baby has started to take the normal food now. From the age of 6 months, he started rice, he started to eat cereal, the hard food, right? And at the age of 2 years, actually, he is familiar with all the normal food. He's taking rice, he's taking laham, he's taking chicken, he's taking roast, everything he likes. Okay, so gradually there is exercise of the jaw, and the size of the jaw is gradually increasing, but the size of the tooth is unchanged. So what is happening? There will be space in between the deciduous tooth. This is very normal that at the age of 4, 5, or 3, 4, 5 years, you will find some spaces in between the deciduous tooth on the deciduous dentition. So further development of the jaw causes a spacing between the existing deciduous tooth. At the age of 6 years, what is happening? The eruption of permanent first molar into the oral cavity before shedding of any deciduous tooth. Remember this thing. Before any shedding, the first permanent molar will come. The eruption of permanent molar, first molar, is there before shedding of any other tooth. You see, the deciduous tooth will come at the age of 6 to 7 years. First deciduous tooth shedding. Shedding of deciduous tooth starts. At the age of 7 years, what you will see, the permanent central incisors and permanent first molars are in position. Now, the mixed dentition starts from the age of 6 years. It may take some more time within 6 to 7 years, but you will find that permanent central incisors and permanent first molar are in their place by replacing the first deciduous central incisor, upper and lower. And now it is a mixed dentition. The yellow tooth are permanent tooth, the blue tooth are deciduous tooth. So the central incisors and permanent first molar. OPG, this is an orthopentamogram, X-ray of a 7-year-old boy or girl. You'll find that all the deciduous tooth are in position. This is the first permanent molar. First permanent molar is in position. Central incisor is in position. And lateral incisor is also coming, erupting. But here the upper lateral, you see the upper lateral, the permanent tooth is here and deciduous lateral incisor already here. Actually, this is canine. This is canine. This is deciduous lateral incisor, permanent lateral incisor, and you see the deciduous lateral incisor is not in place. The second permanent molar crown is under formation because it starts its development at the age of 3 years. So by the age of 4, 5, 6, 7 years, the crown is almost complete, but not yet erupted. Okay, so this is the situation. The two premolars are under the first deciduous molar and second deciduous molar. The canine is under the deciduous canine. So this is the situation in the age of 7 years. And this situation may happen also. You see, 1, 2, 3, 4, these are permanent tooth. But due to lack of space due to the maldevelopment of the jaw, the last tooth, the lower lateral incisor who came last, he is taking his position lingually. So this is known as crowding. So after the extraction of the tooth of canine, this is the canine, this is the canine. When if the jaw is becoming bigger, it will take its place. And another situation you see here, retained deciduous, 7 to 8 years. The permanent tooth is already in the position, but you see the lateral deciduous and here the deciduous did not fall down. Okay, so the tooth are coming in the lingual position, because this may also happen sometimes during the eruption that the deciduous tooth is not falling down on time and permanent tooth is coming little bit lingual. Why it is lingual? We have explanation that because our tooth jam is always lingually positioned on the permanent tooth. The tooth jam of the permanent tooth is always lingual to the deciduous tooth. So retained deciduous or malposition tooth may be seen at the age of 7 to 8 years. Mixed dentition, total 24 teeth. Each quadrant of jaw contains 3 permanent and 3 deciduous tooth. Okay. Number of permanent tooth and deciduous tooth are equal in the dentition. This is at the age of 9 years. Remember, this one question will come from this slide. At the age of 9 years, the mixed dentition is having a very nice combination of equal number of permanent tooth and equal number of deciduous tooth. What are the permanent tooth? Upper central, upper lateral, and first permanent molar. Lower central, lower lateral, and first permanent molar. Now, who is remaining? The upper canine, upper first molar, upper second molar. Lower canine, lower first molar, lower second molar for the deciduous dentition is remaining. So 3 permanent and 3 deciduous, altogether 24 teeth. Evidence of permanent third molar tooth jam is seen. Now at the age of 8 years, the calcification of permanent third molar has been started. So if we take an OPG, you will find that there is evidence of calcification of the upper and lower third molar. At the age of 10 years, what is happening? Still 24 teeth in the dentition, 3 deciduous teeth in each side, upper and lower, totaling 6 deciduous teeth and 18 permanent teeth. Before it was, by the age of 10 years, you see, already the canines are its first premolars are in position. Lower canine is in position. So 1, 2, 3, 4, 5, 4, 5. 5 and 5, 10 deciduous permanent, 6 deciduous teeth is present in total, and 18 permanent tooth is present in total into the oral cavity on the both sides. Ten years, you will find that the permanent first molar is there in position, the canine is in position, but the second deciduous molar is retaining maybe, and the second premolar is trying to come. So this is the situation. You will find 2 permanent tooth on the both sides of second deciduous molar and premolar is coming. 11 years, permanent second molars are ready to erupt 11 to 12 years. The permanent second molars are ready to come. By this time, the 11 to 12 years, all deciduous tooth goes down and second premolar and the lately coming upper canine all are coming into the oral cavity. 12 years, the second molar, permanent molar will come into the mouth at the age of 12 years. But 11 years, it is about ready to come. So this is the X-ray OPG orthopantomograph for a 10 to 11 years children. You'll find that the second premolar is ready to come. Second premolar. This is second premolar, and second molar is also ready to come. Second molar. This is third molar. Okay. This is third molar. Second molar, you see, the crown is complete. The root has been started. Emergence of all permanent second molar at the age of 12 years. At the age of 12 years, how many tooth? Every quadrant is having 7 tooth. 1, 2, 3, 4, 5. Replacing the 5 deciduous tooth and first permanent molar and second permanent molar. Altogether 7 tooth in each quadrant. Altogether 28 tooth is present at the age of 12 years. These 28 tooth will continue until the age of 18 years, until the third molar is coming into the mouth. Depending on how much third molar is coming into the mouth, the number will vary from 28 to 32, starting from 18 years to 25 years. So 12 years plus, what you will find, no deciduous tooth present in the mouth. All the permanent tooth has erupted except third molar. The third molar is not yet erupted. Crown is completed for developing permanent third molar tooth jam. The permanent second molar is either erupted or the crown just emerged into the oral cavity. 12 years and more, either it is erupted, second permanent molar, or erupted but not completed. Eruption is not completed. So this is the situation at the age of 12 years plus. Here you see 1, 2, 3, 4, 5, 6, 7, upper and lower. 1, 2, 3, 4, 5, 6, 7, upper and lower. Altogether 28 tooth into the oral cavity. All are permanent dentition. But unfortunately, sometimes there are some retained deciduous tooth. Retained deciduous teeth is also present if the deciduous tooth are not shedding correctly on time. So this is the even X-ray or orthopantomogram. You see the canine is coming lately, upper canine. Upper central, lateral, upper canine is trying to come. And lower, first, second, 1, 2, 3, 4. One premolar is missing here. Now this is canine, this is first one, second premolar is missing. Congenitally, second premolar is missing here. Okay. Development of the root for the permanent second molar is complete. Developing third molar crown is in its position at the age of 12 years plus, 13, 14, 15. But the permanent tooth jam, because the root of the permanent second molar will take another 3 years. So by the age of 15 years, 12 years means 12 years plus means by the age of 15 years, the root of the second permanent molar is complete. More than 15 years. What is happening actually? Example of impacted wisdom tooth. 15 years and onwards, you will find there are 4 tooth germ. Third molar is ready to come, but not yet come. They will start to come at the age of 18 years. So they may be sometimes impacted 18, 19, 20 years. The 4 tooth germ, you see, the 4 tooth germ is ready to come. So this is the actual slide. This is the slide actually. You will find this slide, the same picture in the Wheeler book or textbook. This is sequentially has shown all the deciduous dentition, mixed dentition, and permanent dentition when they are coming. From here, we have explained all the things. So this is the summary, the number of tooth in the mouth at different time. Okay, so you must see these things and you will discuss. Inshallah, we'll discuss that we have discussed already. So if you have any question, please ask me, guys.